So I'm gonna do manual ventilation with a ET tube in place. So first and foremost is I have to check the patient's chart, verify the physician's order, and then once I'm done, I'm gonna wash my hands and apply PPE such as a gown, gloves, face shield, and also a mask to protect myself from any exposure like blood. And then now that I'm inside the patient's room, I'm going to introduce myself that I'm here to give manual ventilation to the patient, and with the ET tube in place, we also have here the pharyngeal airway. So it's on here in the beside the ET tube. So this one, its purpose is to prevent, especially from the tongue to being obstructed, and also it will guide also as a bite block to prevent from the ET tube being bite by the patient's teeth. And then when we gonna start the manual ventilation, we have to ensure that we have the device in place, and we also have to double check the device if there will be any misconnections into it or any missing parts. So now that we're ready to go, I'm going to attach this to the oxygen source. Set the flow to 15 liters, and then before you put this one to the patient's ET tube, we have to check the reservoir bag if it's fully inflated, and then make sure that every time we give breaths, it won't deflate. It will maintain its inflation to it. So we're gonna insert this to the ET tube, and then we're gonna make sure that we're gonna hold the, notice my hand, the ET tube, to prevent the ET tube from keep on moving even though it's secured. And then we're gonna make sure that if possible we can do a head to chin lift or even a jaw thrust, or we can ask some assistance. So I'm gonna give manual breaths to it, and then once we're gonna give manual breaths, we never give too much air and too fast or hyperventilate. And we also have to observe the patient's chest rise. So for example, if I'm already done giving manual breaths, I'm going to remove the ambu bag, set the flow meter back to 0, and make sure that we're gonna put this one in the safe place. And then also another important thing, if we give manual ventilation, aside from checking the patient's chest rise, we also have to auscultate to make sure that the ET tube is in place. Or if we notice there's air coming out directly from the patient's mouth, we either have to check if there will be like the cuff, is it inflated, or we have to either set the lip level, either we have to pull a little bit, readjust. And then we also have to check for the SpO2 and patient's color. And also once everything is cleared, we're going to have to document everything of what we did with the manual ventilation, what our observations are, remove the PPE, the mask, eye shield, and also dispose it in a proper waste disposal. And I think that's all.